But let's talk about social care with Lucy Johnston. Lucy, very good morning to you.
Hello, good morning.
Thanks very much for joining us. I mean, this will come as no surprise to you. It certainly didn't to me. The fact that we can't discharge the elderly who are actually no longer required to be in hospital into care homes because there isn't any room is yet another sort of indication that we're sort of not really providing for the future, are we?
It's a national scandal. We've had, in the last 20 years, about 12 different green papers or white papers on this and about 5 different reviews. And actually not being able to discharge patients, and in some points, there's about 25% of beds are taken up by patients who are medically fit to leave. Yeah. So that's bad for patients because if you're old and frail, you are not mobilizing and you soon lose muscle strength very, very quickly, and you can become immobile. You're more at risk of infection. It's also very bad for the NHS because that causes what they call bed blocking, and that leads to ambulance delays and blocks in the system, and those are also deadly. So this is something that really needs fixing, and a large part of it is down to the fact that the term Department of Health and Social Care is really a misnomer. Department of Health gets about £150 billion. The Department of Social Care is pretty much ignored in that context, and it gets a sixth of the funding, and the funding has been declining in real terms over the past decades. The care workers get minimum wage or not much more than that, so there's vacancies there, and we have a huge problem coming because we have not only an ageing population, but we have a population which is increasingly ill. And there's a recent report shows that by 2040, there'll be 2.5 million more people with long-term conditions. So that'll be 1 in 5 of us will have a long-term condition such as a heart condition or diabetes, and we'll need much more care then, but we just don't have the services to help people in their homes. No. So we've got huge problems coming.
And I mean, how are you going to solve it though? Because, you know, we talked about this, probably you and I have spoken about it before, but all the way through the last government and probably the one before that, you know, there was talk about reforming the whole system, making local councils less reliant on central government money, you know, changing the way that the social care business was run, and stopping so many people from making so much money out of it.
Well, absolutely. I think one of the key things is to increase wages for care workers. We know that we have a big shortage of care workers in the country, and you know, it's tea or we. Care workers haven't got time to help people, and they have 15-minute appointments, and there is a big gap there. I think 1 in 9 posts are vacant right now. Yeah. But we also need to look at the health system as a whole. The lack of weekend working means that patients are less likely to get discharged at the weekend. They get stuck. Right. And because of that, you know, the system isn't working together. So the social care system doesn't work at the weekend. They both get paid. The Department of Health, it's cost about £400 a day to have a bed in hospital, and care homes will be getting their money. So there needs to be some kind of tension in the system so that it's in everyone's interest to get patients out and to get them properly into a place where they are safe. So we need to get also a lot of the care providers are not connected. Right.
Lucy, terribly sorry, I've got to stop you. We're running out of time. But listen, thank you so much for that.